How did it break down? Well, again, these are the 4 groups. These are the number of parishes in each group. So you had 14 in the low group, 12 in the high group, which was the worst group, and then 19 each in those 2 middle groups. But more importantly, how many children are in each of those parishes? So you see the breakdown, 26% are in those low parishes, but you have 35% in those bottom 2 groups. So you have a state that's like 47th or so, and of that, you have 35% are in the kind of worst situation in a state that isn't doing very well, and that represents just over 100,000 children. So 100,000 children under the age of 5 who are growing up in these more risk-defined areas. So what are some of the things we found in here? Well, again, everybody had issues. So 86% of the parishes rated high risk on at least one indicator. So that's almost everybody, but all but 2, I think it was 2 or 3, were moderate high risk or high risk on everything. So that's one key message, is everybody has issues, even the best parishes. Now, of the low risk group, right, so those 14 that ended up in the best category, all 11 of the 14 had at least one indicator that was high risk. So again, even those that have plenty to celebrate and a lot of strengths, they all have weaknesses as well. The flip side of it is all but 2 of the parishes that were in the high risk group had at least 2 indicators that were low or low moderate. So even if you were one of those dark green parishes at the end, you had strengths, that you were in one of the top 2 tiers on at least 2 indicators. So lots of positive messages there. For economic risk, again, there were 5 factors of economic risk. 3 parishes were high risk on all 5 of those indicators. Over half had at least 1 of the 5 indicators that were high risk. Now, we know that the economic issues are huge in our state. We had 31% of our children under the age of 5 who were living in poverty. That compares to 23% nationally. You know, and when I say compare, like, that national number is awful, right? That's more than 1 in 5. In our state, it's almost 1 in 3. However, 17 parishes were better, you know, lower poverty for children under 5 than that national number. So 17 parishes were doing better than the national rate. 7 parishes were doing better in terms of median income compared to the nation, and 5 parishes were better than the national average of births to single mothers, which has increased considerably in the state over the last decade. Now, with health risks, these are the ones that get a lot more attention, that seem to end up on every national report card. But 59% were high risk on at least 1 indicator. 1 parish was high risk on all 4 indicators. And here's just some images. So this is percent of low birth weight babies, right? So in the country, our state is about 30% worse than the national average, and you know, our country does not do well on this indicator. 9 parishes were better than that 8.2% national. For teen birth rate, again, we're about 34% behind the national average, and only 4 parishes did better than that national number. Infant mortality, which is definitely the worst case scenario, we're 41% worse than the national average. Again, not something our country does very well in, and 8 parishes were better than the national number. And then lastly, on education risk in Louisiana, 5 parishes were high risk on both indicators. There was only 2 indicators. 4 were high risk on one, but low risk on the other. So most were fairly well mixed throughout. So then the issue is, what programs are out there and how do they provide services juxtaposed against the map of risk? And it's not to say that it should be an exact relationship, because there's lots of reasons why you might provide more services in a certain parish than another parish. Availability, uptake from the people there, you know, lots of issues that administrators of state programs deal with all the time. But I do think it's worth noting and then saying, well, what's going on in terms of the state budget for these programs, and just noting some of the trends. So this is children in subsidized childcare that's 3 stars or above. So this is basically the state is paying some portion of the cost of this care, and they're at a child care provider that's 3 stars or above. And unfortunately, we've seen money for the subsidy program in the state decrease 24% since, I can't remember, yes, just in the last year, maybe fiscal year 10, whatever. In the last 2 or 3 years, it's decreased 24%. A mental health program, this was a very small program serving just a small handful of parishes. So you don't see a lot of circles on that page, but this program was completely eliminated in December in the budget cuts then. Nurse Family Partnership, which is a home visiting program that was started in the state in 1999, has a wide reach in terms of touching almost every parish, although it's small percentages in each of those parishes. Unfortunately, in the budget cuts in December, they had a reduction that, if annualized, which I believe it will be, although first I want to point out just the way you would use these maps. Again, you see some very small circles in high-risk areas, and as a stakeholder, whether you're government or non-governmental, you would be able to ask the appropriate question, can we adjust this? Clearly there's lots of kids here in need. Are we able to get them more services, or why is it the way it is? And again, there could be very good reasons how programs evolve that way. But we have seen that money drop on an annualized cut in December of 15%. Early Steps program, and this is another way to look at things, is not just against the overall risk, and again, we would see some small circles in high-risk areas, but also against things that we would say might be predictive of people who would use these services. And here, these are the circles from the previous page. Now the colors of some of those parishes are different, and different parishes become dark. So lots of different ways that this information can be used by stakeholders. Head Start is identified in there as well, juxtaposed against overall risk as well as poverty. And then the state-funded pre-K programs, which is all of the pre-K programs, LA4, the non-public school program, 8G, locally funded, Title I, all of those are here as well. So our website, which is listed here, you can go there and download the report. It's a big file, but you can download the report and have all of the maps and all of the explanation. And then lastly, before I turn it over to Kirby, I'm just going to talk about expenditures, right? So then the issue is, we have identified the risk and we know the reach. What's really going on with the money in the state? How much do we spend to provide services to these young children? Now, again, we've heard a lot in the last few days since the president came out with his proposal to expand early childhood services, and the argument has been very much around the cost benefit, that these expenditures pay back to society. And there's various longitudinal studies that go back to the 60s and the 70s, that justify or that really are the reason that we're saying this is huge economic benefit, huge payback for the investments we make. And various economists have documented this. If you got a 7% return over 20 years on a $1,000 investment, solid 7% return in the stock market, you'd have $4,000. If you invested in these early childhood programs, you'd get a 16% return. That same $1,000 would be the equivalent of $19,000. So it makes a lot of sense in terms of how government's going to use money. And the economist who gets the most attention around this is a Nobel Prize-winning economist named James Heckman, and you may have heard him on the radio because he's there. Every news program that's talking about this now gets Dr. Heckman, and he basically has this visual in terms of the return on the public investment, that the earlier you make those investments, the greater return, the more success you have for the program. And when he talks about it, he says it's really about the soft skills, right? And look at the words that he used. This is a quote from him. And you talk about attentiveness, perseverance, impulse control. Now, an economist doesn't use the words executive function, but those are the words executive function that we were talking about before, right? And so he's right. It's those other skills that are really the skills that, by nurturing them when they're young, pay off for you down the road. And then this quote from him I've been using for years because, unfortunately, it's always very topical. But as states are under constant pressure to improve the efficient use of ever-dwindling financial resources, any investment away from young children can be viewed as a diversion from the most efficient use of those funds. So how often is that the equation in terms of the expenditures that we make? So this is what we spend for young children, and this is based on the early childhood budget that the state puts out. Of our $25 billion budget, about 56% of that are state funds, and of those state funds, less than 3% go toward young children. Less than 10% of the federal funds, which are mainly prescribed for young children. So of the overall $25 billion budget, $1.3 billion go toward young children. The majority of that is for Medicaid. If we pull Medicaid out of the picture, which is 54% of the picture, these numbers go way down. If you take Medicaid out of the state budget and the early childhood budget, What do we do for children? About 3% of the expenditures are for young children, 1.5% of our state dollars. And this is what the pie would look like. This is how we spend the money. Of the money for young children, about 60% for healthcare, 20% for early care and education, 18% for family support and parenting education, and that little sliver there, that's 0.6% for mental health, social emotional development. The key areas of executive function that need to be nurtured. And that number is based on, those are pre-cut numbers. So like that early childhood supports and services, that program makes up the most of that 0.6 sliver. So that 0.6 is shrinking dramatically. And this is how the early childhood budget has fared since fiscal year 10. So the last 4 years, it's gone down about 6%, so not too dramatic there, but the money spent for early care and education has shrunk 16%. So it just shows you, we want to reform the system. The state's doing a lot of work around that, but we have less financial resources to make that happen at a time when we really need to be investing more if we want to be successful there. And with that, I will turn it over to my partner, Kirby.
Let me start with this. Here's a basic model of public opinion, and my question sort of is, how does public opinion translate into action? In a democracy, we want to believe that public opinion should matter. That is, that it should translate into policy outcomes that are consistent with public preferences and sentiments. The translation of opinion into actual policy, however, is rarely straightforward. And there are some basic questions represented in this particular chart. One is, what is the level of public support for an issue or a program? What's the intensity of support? Intensity also matters. And what's the salience of support? How important is an issue relative to other issues and other concerns? There's also questions about the communication of support, where we get into the white box there. Who is communicating? How effectively are they communicating? And what we see in democracy is that the people who participate aren't always the public overall. Some people, political pollsters, will say, I don't care about the public overall, I care about who turns out and who votes on election day. Right? And that's reflected in this idea of participatory bias, and the idea of mobilizing support, and in the idea of organization mattering. So with that in mind, we'll turn to the Moneyball question, which is, why does an overwhelming public support for early childhood translate into policy? Well, we can think about sort of 3 different types of issues that are at stake here. So one issue that is potentially a problem is just a lack of support. I'm going to show you data here that's going to tell you that's not the problem. It's not a problem of a lack of support. A second problem is a distribution problem. And in a distribution problem, what I mean is we have a majority support, but there's a really intense minority against the program or the policy or the issue. Now, there are some differences, and I'll show you some differences across groups in terms of level of support here. But that really doesn't work very well here as an explanation either. And then third is the salience problem, which is how important is the issue relative to other issues and other concerns, which is especially important when we're talking about declining state dollars. Now, as I go through this, we're going to look at some public opinion data that we've collected at the Public Policy Research Lab at LSU. Much of that is coming from our annual Louisiana survey. I'm also going to show you, it's in the context of studies done in other places, in other states, in other places at other times. And one of the striking things is how consistent the numbers are across place and across time. This isn't something that's specific to Louisiana when we talk about public opinion on this issue. Okay? First question that we have some pretty good data on, going from 2009 to 2011, is, are we doing enough to ensure children enter kindergarten with the skills necessary to succeed? A majority of respondents across multiple years of data collection say no. What's also striking is almost no one. So the blue line there is people who are saying we're not doing enough. The gold line is people saying we're doing about the right amount. And then the purplish line is people saying we're doing too much. Almost no one says we're doing too much for early childhood. No one. Okay? Of those saying we're doing about the right amount, most believe that either one, government should have a limited role in early childhood development. This is the role of the family. That's a value statement, and I'll come back to it as we move forward. Two, kids can just catch up in K through 12. Let's just let them be kids, right? We know that's an issue, right? We know from the evidence that Geoff has presented that that's a concern. Or three, that government spending on pre-K doesn't yield a strong return on investment. It's not effective. It's money that's wasted. We know as well that that's not true based on the data that Geoff has presented. Okay? When we look at this across different groups, we only see declines in a couple of different areas. So we cut this all different ways. We looked at different levels of support. Really, there are only two different groups where we see strong differences. This is the percent saying we're not doing enough. So when we look at race, white respondents are less likely to say we are not doing enough. Though again, they're not saying we're doing too much. They're saying we're doing about the right amount. Then black respondents or other racial and ethnic minorities. And when we look at partisan affiliation, as we move across partisan affiliation, we see that the strong Republican group is less likely to say we're not doing enough here. Okay? But even across partisan affiliation, those numbers aren't hugely different, and if we lump Republicans with strong Republicans, the differences are not as large as one might imagine, and certainly not as large as you might imagine in a different issue area. Okay? Second question that we ask is whether Louisiana government should do more in terms of providing funding so 4-year-olds can attend high-quality pre-K. A few key things about the question. It's should we provide sufficient funding, it's high-quality pre-K, and if the parents want to send them. Across the years that we've done this, we see some variation from year to year, but the variation is from basically 2/3 of the population saying, yes, we should provide sufficient funding for pre-K programs, to about 3/4 of the population saying that we should provide sufficient funding. Now, looking at the data in different places and in different areas, the question's been asked all sorts of different ways. It's been placed in the context of spending cuts. What happens if would you still support this if we cut spending in other areas? Still strong support. Would you still support this if you had to personally pay more in taxes? Still strong support. If we tell you how much it costs on a per pupil basis, do you still support this? Still strong support. If we tell you how much it costs overall to the overall system, still we have very strong support. Okay? It's also strong across partisan identification and ideology, with a few notable exceptions. Though the bottom line is ideology, it drops from 69% support for conservative to 59% for strong or very conservative. So it's a 10-point drop, but it's still more than 50%. When we look at partisan affiliation, it drops below 50%, but just barely below 50%, and it's still the plurality response. So we do see some differences by partisan affiliation and ideology, but again, they're not as strong as in other areas of government spending. Overall then, public support for early childhood can be described as strong. Majorities believe we're not doing enough. They support greater funding even when made aware the costs are connected to an increase in taxes. It's stable. It persists over time. We see some variation from year to year, but the variation is not fundamentally changing sort of the big narrative of support, and it's widespread. Support is strong across demographic groups and across geographies. In the studies that we're talking about that we place this in context of, they've done similar work in Texas, Alabama, Minnesota, Michigan, Connecticut. If they were presenting the results from those states, they would look very similar to these numbers. So we're back to the puzzle, though. Why does an overwhelming public support for early childhood education translate into policy? And it brings us back to this salience issue. Here is self-identified most important problem in our most recent Louisiana survey. We asked people what's the most important problem. In Louisiana, 2 problems tend to rate higher than any other set of problems, and I think this is true in most states: education and the economy. Now this is open-ended. We're just asking people give us whatever they want and we code it. Now, I don't have the exact number, but the slice of the education pie there that goes and where people say early childhood is very small. Okay? So it's not top of mind in terms of how people think about what are the problems that we need to address, what are the issues that we need to address. Okay? When we look at these numbers over time, the red line here is the economy and jobs, the blue line is education, and what we see in 2009, when the bottom dropped out of the economy jumped way up in importance, and everybody was saying the economy and jobs, and the concern about education declined. We see it coming back up now as the economy is recovering a bit, but what that tells us is fewer people identifying education and fewer people concerned about early childhood. Okay? So this presents us with both a challenge and an opportunity. Okay? So I think the challenge is how do you break through the noise? And how do you break through the noise, especially when you're talking about declining budgets and you're talking about shrinking government dollars? The opportunity, I think, is in the data that Geoff presented, and that is making the case that early childhood is the one thing that we know that is at once effective and can have ripple effects across all of these different issue areas. So we can think about it like this. My graph skills aren't super, but I do what I can. Early childhood is sort of the centerpiece that affects, we know that it affects graduation rates. We know that it affects kindergarten readiness. We know that it affects crime rates and youth violence. We know that it affects overall health, and we know that it affects the economy. So it's affecting all these other things. When we look at arguments that people identify for and against early childhood education, there's also some good news. Because most of the arguments for early childhood people are already making the connection. They already see the connection at some level. So this is from the Michigan study, and people identified these arguments as arguments for reduce youth violence, increase graduation rates, reduce government spending on social services, prepare kids better for kindergarten, create fairness and equality, and then improve the overall, dealing with the overall effectiveness of the programs. Everyone recognizes these arguments and are generally supportive of the idea of the arguments as positive reasons for early childhood education. Okay? In terms of the arguments against early childhood education, we have both the value statements. Don't make it mandatory. This is really about family and not about social programs. It's the responsibility of parents. And then we have empirical statements. On the value statements, I think it's just important that advocates be sensitive, right? This is not to replace family. This is not mandatory. This is to provide resources to people who need resources. On the empirical questions, though, and I think this appeals especially to where we see some of the opposition, we have empirical evidence. Okay? Early childhood doesn't come at the expense of K through 12 education. It enhances it. Early childhood doesn't come at the expense of healthy communities. It makes those communities healthier. Early childhood doesn't come at the expense of the economy or economic development. It doesn't cost us jobs. It creates wealth, and it helps to produce a more productive and skilled workforce. The weight of the evidence is clearly on the side of early childhood education. Okay? One final sort of point in terms of investment in early childhood education, we know when we're talking about government spending and support for government spending, it's incredibly fickle. Right? People say they support spending on something until they have to actually pay for it. Right? There are sort of two issues that I think are really important here. One is people will support spending when spending is addressing an important problem. And I pulled the data from the Michigan study just because it's very recent and very comprehensive. They included town halls and public opinion. 68% described early childhood education as crucial or very important. Okay? The second question then is, do you get the return on investment? And in the Michigan study, 43% said yes, 38% said no. So there's some work to do in terms of convincing people that you're getting the return on investment that you hope for. Okay? So this is a picture outside of Shenandoah Elementary. I live out in Shenandoah, and every so often I would drive past the elementary school and see people camping out. This was a couple of years ago. I'm sure many of you all remember this. Some of you all may have camped out for similar reasons. And they were camping out to register for pre-K programs. A couple of years ago, someone cut in line. I don't know the specifics of the story, and there was an actual fight, and the sheriff's office had to be called out to deal with this. We moved to a lottery system, and then we decided that the lottery system was probably best replaced with a system that allows for screening so that we're getting money to kids who are most in need of these resources. A couple of concluding observations. Parents clearly recognize the value of these programs. If they're camping out, they recognize the value of these programs. The question is, how do you get them mobilized in a way that generates support for it at a system level? Okay? Second, there has to be a better way for doing this. If we're going to have limited slots, maybe we should auction them off on eBay. But maybe the simplest solution is the best. Let's just make sure that high-quality early education programs are available to families. This isn't a government giveaway. It's an investment in our community, and it's an investment that we can't afford not to make. So with that, I'll turn it back over to Geoff.
Thanks, Kirby. So just a few closing thoughts, how we integrate all the information we threw at you tonight. First of all, we have to start early, right? It's not just about pre-K, it's earlier than pre-K. Remember, we only have 1,800 or so days. We can't wait till the last 300. And that's because it's what children need, and as Kirby just outlined, it's what the public wants as well. I mean, there's really no reason we can't get there with the appropriate leadership. We have to be comprehensive. This is not just about education, which oftentimes comes down to literacy issues and literacy initiatives. It's much more broad than that, and we have to be thinking about the children's health, their mental health, their social emotional development, parenting support and education, family support, child welfare, safety, all of these things, because children don't grow up in just one of those areas. They grow up in that comprehensively. Be informed, right? That's what Kirby and I try to do with this report, is to give you information, to give everybody information. This report, along with the early childhood budget, along with other information that you get, we have to be informed and then use that information to push for whatever it is we want. And so we hope that this is a piece of what informs you and mobilizes you to action. And then create and take advantage of new opportunities. There may be new opportunities coming from the federal government, maybe not. Maybe we should create our own here. But we haven't always taken advantage of all the opportunities out there. I mean, most recently, the Race to the Top Early Learning Challenge, we had the opportunity to pursue $60 million over 4 years for the state, and we didn't do that. So we have to demand that we go after every single opportunity we have for our children, because we do not have enough resources right now. So with that, I will say thank you and turn it back over to Dr. Jones.